Okay, so for this one, the first case is the CPT code was 61867. So I'm going to explain a little bit about the procedure, and then we'll take a look at the actual op note. Just note that this is not, there's no specific coding guidelines that you're going to find in your book. I just want to explain the procedure. So the surgeon performs a twist or drill burr hole, basically going into the skull. And then they're doing it for stereotactic implantation of deep brain neurostimulator electrodes arrays with intraoperative use of microelectro recording. So this procedure is usually done for uncontrolled tremors. So in this instance, the patient had some uncontrolled tremors. And before surgery has even begun, they will take a CT imaging or imaging another way. In this instance, the patient had an MRI brain under general anesthesia prior to the date of surgery, and then actually on the date of surgery, they had a CT done. I just want to point that out. I did not have you guys code the CT, but those are recorded separately as they are not part of the procedure. But because of these CTs, the reason why they're so important is because they take those images and they use them as a kind of a target point for where to place the electrodes. And then that gives them an idea of when they start actually going in, where are they going to place the microelectrodes and the electrodes. So moving on down to the procedure, this is where they actually start doing the burr hole into the dura being exposed here. And then they're talking a little bit further about actually placing the microelectrodes platform and then placing it over the site of the burr hole. So right here is when they're actually talking about the microelectrode, and then here it's talking about the microelectrode recording being performed. The recording is also part of the procedure and not separately reportable. During the 61867 procedure code, they actually do that, and stimulation is done during the targeting and repositioning of the electrodes just to determine the best placement. So that is all part of the procedure and not separately reported. The next part of the procedure was 61885. This is another CPT coded needed for this case. So in this instance, the physician is inserting a cranial neurostimulator pulse generator or receiver into a subcutaneous pocket. The physician selects a location site, usually the infraclavicular area, and sizes the skin. Using blunt dissection, the physician creates a pocket, and then the unit is connected to the previous position electrode array, which we just talked about earlier. So right here is when they actually start, when they make the incision, and then right down here is where they're talking about making a pocket. So the generator was placed into the pocket with care to keep the excess lead deep to the generator. So the Prolene sutures were placed to secure the device at the two holes. The wound was irrigated. Again, there's no additional CPT code for the Prolene sutures to close the wound area or the incision site up. There were 3 implant codes on this one, which were also listed below the op note for the generator, which was C1767, the neurostimulator, the non-rechargeable, and then the neurostimulator lead, C1883, and then the actual prosthetic for the implantable neurostimulator pulse generator was 118679.